Regardless of the type of asthma that you have, everyone who has asthma really should have an action plan. The action plan is a step-by-step description of what medicines to use at what stage. Whether or not that your symptoms are an increase in cough, chest tightness, shortness of breath, or increased work of breathing, you're not going to be able to tell exactly where the asthma is just from looking or listening. And so first thing we start off with the action plan is the fast-acting treatment, which will kind of give us an idea of where we are in the course. Albuterol starts to work in about 10 seconds. The peak effect is about 15 minutes and it lasts for 3 to 4 hours. It is very good at trying to relax any of the muscles that are in spasm right now. It is not very good at protecting those muscles from going into spasm even an hour from now. So I never use albuterol really on a schedule. You use it when you are seeing the symptoms that are bothersome, and then you watch to see how well it responds. Whenever it gets better, you know that's the muscle spasm part. The other part, as we talked about earlier, is the swelling and mucus on the inside of those tubes. Albuterol doesn't do anything for that. The only thing that we know that will take that down once it's there is one of the anti-inflammatory steroids. Those medicines usually take 12 to 24 hours to start working, so they don't work fast. But they will shrink the swelling and mucus that's down there. They'll stop new mucus and swelling from coming, and it decreases the twitchiness to break the whole cycle. The steroid is the definitive treatment for an asthma flare, whereas albuterol, all we're hoping to do is get short-term symptom relief, and it will only work if it's muscle spasm. When we start the prednisone, the goal is to get the air tubes completely clear. We don't want to leave even a little inflammation on the inside of those air tubes, or we risk either having that drag on for a long period of time, or even possibly cycling back into a new flare even without a new trigger. On the other hand, once we've gotten clear, there's no reason to keep taking it. It's not like an antibiotic where you have to finish the course. And so when you start coughing, seeing coughing to the point where it's bothersome, or any increased work or breathing, then you reach for your action plan. Your action plan is going to start with albuterol. If the albuterol clears things for 3 to 4 hours, that's all you need to do. You just repeat the albuterol when needed. The first time it doesn't clear you for 3 to 4 hours, now you know that we're starting to have the swelling and mucus on the inside of those air tubes, and it's time for the steroid. When we start the steroid, we go twice a day until completely clear. 0 cough, wheeze, or chest rattle for 24 hours, and then stop. The limitations is that I don't want you going more than 10 days without talking to us. Ask you to call me the next business day whenever you start the prednisone or the steroids. It's not asking permission. I'm giving you permission now. The reason for the phone call is so I can monitor how often it's happening and how close together to make sure that we don't run it into any trouble with it. If you've gone 10 days and you're still not clear, and sometimes some of the viruses, some of the triggers last more than 10 days, so you might not get clear by the end. And in those instances, at 10 days, we need to start talking about where we're going to go from there to keep moving forward as safely as possible. And we'll talk about that on the phone.